Earlier today, I gave you this patient and asked you what causes blood to come up and vomit. Let's talk about it. Okay, so let's talk about vomiting blood. So when it comes to that, it's typically from the esophagus. So this is your stomach down here, and this is your esophagus. Now the esophagus is lined with the blue here being the blood vessels that lining the esophagus. So the two big reasons that we can have bleeding are esophageal varices, or we could have a complete esophageal rupture. So let's talk about varices first. What varices are outpouchings like you can see here. And these outpouchings are weakened vessel walls over a time of high pressure, high portal pressures that are causing these outpouchings like so. So as an outpouching, they're not dangerous yet. But what becomes dangerous is if they rupture. Because if they rupture, that means that they are allowed to have unimpeded blood flow out into the esophagus itself. And so when you have that, you can have patients that are actually vomiting up blood because of these damaged vessels that are leaking blood into the esophagus that ultimately is being vomited out. That's not the only reason. Again, like I said, esophageal rupture can occur as well. And that's when you actually rupture the lining of the esophagus that's also tearing these vessels that are, again, very potent around this area that causes a significant amount of increased bleeding in the esophagus that ultimately can be vomited out. Both of these emergencies are significant. They can cause significant hemorrhagic shock, and both of these emergencies are very difficult to treat. And so time is of the essence. And so getting them to a facility that can actually treat this is imperative.